What if I told you that some people live perfectly normal lives with only half a brain, or sometimes even less than that? And I know what you're thinking, we all know someone who seems to fit that description. But no, I'm not talking about stupidity. What I'm talking about is real clinical cases of people missing or having major damage to large portions of their brain, yet somehow living completely normal lives. How can this be? As far as most people are concerned, brains are delicate things. A simple fall and a knock on the head can be fatal, or at the very least leave us with life-altering injuries. To understand how this is possible, we need to go to France. Now, this is not just me, an Englishman insulting an old adversary, the location of one of the most interesting clinical psychology cases ever recorded. Our story begins with a 44-year-old Frenchman who worked as a civil servant, was married with 2 children, and by all accounts was living a relatively normal life. Because we do not know his name or what he looks like due to clinical anonymity, I've taken some creative license. I like to imagine him eating cheese, drinking wine, and attending the odd protest when the price of onions goes up by 1%. Just like any ordinary Frenchman. Our anonymous onion enthusiast story begins with him going to see a doctor concerning a slight weakness in his left leg. When medical staff looked up his medical history, they noticed that at just 6 months old, doctors discovered that his brain was filling up with too much fluid, a condition known as hydrocephalus. This literally means water on the brain, but it's not water, it's cerebrospinal fluid, clear liquid that cushions the brain and the spinal cord. In his case, it was building up abnormally, which puts pressure on the brain and can actually be quite dangerous. To treat this, surgeons inserted something called a ventriculoatrial shunt, basically a tiny tube that drains the excess fluid from the brain's internal chambers, called ventricles, into a vein near the heart where the body can safely absorb it. Things seemed to go fairly well for a while, but then at age 14 he experienced weakness and lack of coordination known medically as ataxia and paresis in his left leg. A revision to the shunt fixed the problem, and after that life went on pretty much as normal. Medical staff, now aware of his medical history, ran neuropsychological tests which assess things like memory, attention, and reasoning skills. His IQ comes out at 75. For reference, the average IQ is 100. His verbal IQ, the ability to use and understand language, was relatively decent at 84. But his performance IQ, which reflects problem solving and visual motor skills, was lower at 70. Any lower and he might have met the threshold for mental disability. In short, he wasn't exactly a genius, but he was functioning well enough to live a normal life, raise a family, and hold down a job. That's already surprising enough, but what came next truly baffled the medical team. A CT scan and MRI scan of his brain revealed something almost unbelievable. His brain was, well, mostly missing. Well, not entirely missing, but what brain he did have was incredibly compressed. Here's his brain on the left compared to a normal one on the right. You do not need to be a neuroscientist to spot the difference between the two, that's for sure. His lateral ventricles, normally small cavities filled with fluid, were massively enlarged. In fact, so were his third and fourth ventricles as well. The cortical mantle, the outer layer of the brain where most of our higher thinking happens, was so thin it was described as a sliver, and to top it all off, he had a posterior fossa cyst, a fluid-filled sac at the back of the brain, likely interfering with fluid flow. The diagnosis? A non-communicating hydrocephalus. That means the fluid couldn't circulate properly within the brain due to a blockage, in this case probably one of the tiny exits where the cerebrospinal fluid drains from the brain. Like a kink in a hose, it causes fluid to build up and expand the ventricles. The partial leg weakness was eventually treated with another surgical procedure called a ventriculoperitoneal shunt, this time draining the fluid into his abdomen rather than the heart. After that, the leg symptoms disappeared. Interestingly, what didn't change was the brain structure itself, or the IQ score. Despite having very little intact brain matter, he continued to function just as he had before, really. Which raises a fascinating question. How is it possible to live a normal life with a brain that on a scan is barely there? Before we can answer this, we need to look to another clinical case. In 2014, a 24-year-old Chinese woman visited a hospital in Shandong province with the following symptoms: dizziness, nausea, and a lifelong difficulty with walking and speaking clearly. Unusual perhaps, but not unheard of. Until doctors took a look at her brain scan, and what they saw left them stunned. She was missing an entire part of her brain. This wasn't just any part, this was the cerebellum, and is often described as the brain's control center for balance and coordination. It sits at the back of the skull underneath the larger cerebral hemispheres. It only takes up about 10% of your brain's volume, but it contains over half of the brain's neurons, which gives it a lot of processing power. That's why its Latin-based name, cerebellum, translates to little brain in English. Its main job is to fine-tune our movements. Everything from walking to writing to speaking smoothly relies heavily on the cerebellum. Damage to it usually causes serious problems with balance, coordination, and even some cognitive abilities. And yet, this woman had been living a relatively normal life. This condition is known as cerebellar agenesis, meaning the cerebellum never formed at all during development. It's not missing due to an injury, infection, or surgery, it just never formed. Cases like this are extremely rare. There are fewer than 10 documented in medical history. In many of those, the outcome is severe disability or death. But this woman had survived into adulthood. She'd learnt to walk, talk, and live with a surprising level of independence. Yes, her development had been delayed. She didn't walk until the age of 7 and spoke her first full sentence at 6, but she had made it through childhood, school, and everyday life. Somehow, she was getting by without one of the most essential parts of the human brain, and no one had any idea until she came in for a checkup. What's more, there was no evidence of a replacement structure or obvious workaround in her brain scan, just a gap where the cerebellum should have been. No cerebellum, no catastrophic dysfunction, and no clear explanation. So now we've met two people, one with a brain so compressed it was barely visible, and another missing one of the brain's most vital components, and yet both were walking, talking, and living ordinary lives. If your understanding of how the brain works is starting to feel a little bit shaky, good. It's about to get even stranger. What happens when we take a perfectly healthy brain and deliberately remove half of it? To answer this question, we need to meet Christina Santhaus. When she was just 8 years old, Christina began suffering from violent seizures. Not just the occasional fit, we're talking about hundreds of seizures every day. The cause was Rasmussen's encephalitis, a rare progressive neurological condition where the immune system goes rogue and starts attacking one of the hemispheres of the brain. The result? Seizures, paralysis, and severe cognitive decline if left untreated. In Christina's case, the seizures were so extreme that her doctors made a drastic, almost unthinkable decision. They removed half of her brain. The entire left hemisphere, the side typically responsible for language, logical reasoning, and control of the right-hand side of the body, was surgically taken out in a procedure called a hemispherectomy. Now that sounds like something that should result in, well, death, or at the very least, a life confined to a hospital bed. But Christina survived. Not only did she survive, she thrived. After the surgery, she relearned how to walk. She had some weakness on her right-hand side, but her speech returned. Her personality remained intact. She went back to school, graduated with honours, and eventually earned a master's degree in speech-language pathology. Yes, a person with only half a brain became a speech-language pathologist. But anyway, Christina's not the only person to undergo this procedure. Hemispherectomies are rare but not unheard of, and when performed early in life, especially before puberty, the results can be nothing short of miraculous. Many children go on to live relatively normal lives, attend school, form relationships, and hold jobs, all with one cerebral hemisphere. In Christina's case, she actually went on to become a mother herself. So what's really going on here? Are these people just simply lucky, or is there something deeper, something built into our brains itself that allows this kind of adaptation? Let's talk about the strange, powerful force that makes all of this possible: neuroplasticity. Neuroplasticity is the brain's ability to adapt and change and rewire itself. For most of human history, scientists thought that the brain was a fixed thing, that once it developed, especially into adulthood, it was like a machine. If you lost a part, the function was gone forever. But that's not how the brain works. It's not a machine. It's more like a living, dynamic system. When damage occurs, or as we've seen when parts are missing entirely, the brain has an astonishing ability to compensate. It reroutes functions, strengthens alternative pathways, and sometimes even recruits completely different regions to take over the tasks of the damaged areas. In the case of our French civil servant, it is likely that the remaining sliver of cortex took on the role of the rest, working overtime, perhaps with some inefficiency, but still enough to live a normal life. For the Chinese woman with no cerebellum, other regions, maybe the motor cortex or basal ganglia, stepped in to handle movement and coordination, even if imperfectly. And Christina, the girl with half a brain, she was young enough that her remaining hemisphere was still flexible, still in a state of rapid development. It reorganized itself around the loss. Left hemisphere language functions shifted to the right. Motor control was rewired and reassigned. That is all a product of neuroplasticity. But here's the twist. Neuroplasticity doesn't just help people in extreme cases. It's happening all the time in your brain right now. Watching this video, each thing you've learnt today has changed the physical structure of your brain ever so slightly. And so every time you learn a new skill, form a memory, or even practice a habit, your brain is physically reshaping itself. Neurons fire, connections strengthen, and new pathways are built. Think of it like a forest path. The more often a certain route is walked, the more defined that path becomes. Ignore it for long enough and it slowly fades away. That's how you get better at playing piano or speaking a language. It's how stroke survivors learn to speak again. It's how London taxi drivers grow considerably larger hippocampi, the brain's navigation centre, after years of memorising city streets. It's how therapy helps rewire the emotional brain after trauma. The brain's neuroplastic tendency is essential to everyday life. It's the force behind everything your brain does, from solving maths problems to falling in love to recovering from injury. And while it's especially powerful in children, it never disappears. Even in old age, the brain can adapt, learn, and rebuild, which means, if you take nothing else from these incredible cases, let it be this: your brain is far more resilient and more mysterious than we ever imagined. So my parting message is this: remember, the next time you forget your PIN, lose your keys, or struggle to learn a new skill, chances are that there is someone out there doing better than you, living their life with half a brain. Thank you for watching, and goodbye for now.